In my opinion, from what I'm saying and what I'm doing, the future of medicine is telemedicine.
Every technologist dreams not of making things easier, but of making things possible. That's the dream. So you give me a tool that I can do something with that I couldn't do 5 years ago, oh my gosh.
GPT in 2011 did over 40,000 telemedicine encounters. In schools, we decreased emergency room visits by 27%. In nursing homes, we saved over 60% through the use of video and bringing the doctor to the facility remotely. The data is showing that the ability to provide telemedicine and increased access to care, it's almost incalculable, the costs that are being saved, the money that's being saved. How do we measure families that are able to know what's wrong with their child now for the first time in their lives? How do we measure a stroke victim who now is going to live a functional life as compared to being in a nursing home the rest of their lives? To me, and a lot of families we work with, that can't be quantified.
We can very comfortably convey to other clinicians, to our colleagues, to those who make decisions, who think these decisions are complicated, that the technology itself is no longer the issue.
If you can deliver the decision-making to the physician where the physician is, as opposed to requiring the physician to come to you, you can make a huge difference.
Our physicians were demanding and wanting an iPad application, and looking around, we found that Vidyo was the perfect application for us to put on iPads.
Our neurosurgeons, for beginning to triage head trauma, are carrying tablets, iPads, and they can be away from the hospital. They get an emergency call, they immediately can be online wirelessly and be able to look at the patient, make an assessment. Other aspects that are going to be really important is incorporation of content, so they can look at the brain scan. These become important elements of making a decision about treatment of a stroke or the need to transfer a patient.
The challenge for me with Vidyo is to make a return on investment the first time you turn it on. In my world, physicians are high-value resources. Their time is very, very expensive. If I can capture that time and repurpose it, I can pay for my investment immediately.
In my experience in telemedicine, and again, I've been doing this for a long time, if the technology doesn't work the first time and the quality's not where it needs to be, physicians, people will drop it. They won't use it. So what we found with Vidyo is it's reliable, it's easy, and it's of high quality. And that's really been the hallmark of our program.
I think one of the things that really Vidyo has done well, the company's done well, is they've been responsive to the end user. We said these are things we must have, and then they do it.
I think the fact that we've actually engaged the use of the video conferencing tools as a way of bringing patients into the process is really huge. And there's a huge difference between having somebody on the phone and having somebody virtually present.
We can install the Vidyo software on a patient's laptop or computer in their home. We can bring services into that patient's home. And we've started doing that application in a couple folks for speech therapy. And it's highly successful. We're really changing lives for patients and their families that desperately need services.
So in the past, all my ability to make certain things possible, working with physicians in a different kind of way, was bounded, was controlled by this big, old, clunky technology, big codecs, small networks.
The catalyst for us considering Vidyo as a platform for telemedicine and integrating into our healthcare system really amounted to a number of things. One was the interoperability. That is, that Vidyo responded to our need to be able to connect to legacy systems, which we call H.323 video conferencing systems, in which there had been a large investment. So the fact that we didn't have to, what I'd call rip and replace, what we'd already invested in, the fact that we could now integrate mobile devices became a really important part of our decision.
In most rural counties, there are a few general practitioners, but very few specialists in these rural counties. So we're opening up an incredible quality and consistency of care to folks that haven't had it before. Families are coming out of the nurse's station in tears, but they're tears of joy because they finally understand what they need to do to treat and to take care of their children. So it opens up access that has never been seen before.
Now, when I have a tool like Vidyo, I can immediately make things possible that I couldn't make possible before. It's not return on investment. It's creating something. It's creating a tool that physicians can use in a totally different kind of way.